Here are 10 Puerto Rico Medical Board-style clinical vignettes focused on neuroanatomy of the CNS, each with 4 answer choices and detailed explanations. Vignette 1, Stroke, Middle Cerebral Artery, MCA. A 72-year-old man presents with right-sided weakness, facial droop, and difficulty speaking. He can comprehend but struggles to produce words. What artery is most likely affected? A. Anterior cerebral artery. B. Middle cerebral artery, MC. Posterior cerebral artery, PCA. D. Basilar artery. Answer B. Middle cerebral artery. Explanation. MCA stroke affects the contralateral face and upper limb, often causing Broca's aphasia, expressive aphasia, if in the dominant hemisphere. Vignette 2. Stroke, anterior cerebral artery, ACA. A 67-year-old woman has left leg weakness and urinary incontinence after a stroke. Where is the infarct? A. Anterior cerebral artery, ACA. B. Middle cerebral artery, MCA. C. Posterior cerebral artery, PC. D. Lenticulostriate arteries. Answer. A. Anterior cerebral artery. Explanation. The ACA supplies the medial frontal lobe and paracentral lobule, affecting the lower limb motor and sensory areas. Vignette 3. Stroke, posterior cerebral artery, PCA. A chast 60-year-old man presents with right homonymous hemianopia with macular sparing. Where is the lesion? A. Middle cerebral artery, MCA. B. Anterior cerebral artery, ACA. C. Posterior cerebral artery. D. Basilar artery. Answer C. Posterior cerebral artery. Explanation. PCA infarct affects the occipital lobe, leading to contralateral homonymous hemianopia with macular sparing. Macula receives dual MCA-PCA supply. Vignette 4. Basilar artery stroke, locked-in syndrome. A 55-year-old man has a stroke and can only blink his eyes. He is awake but has quadriplegia and cannot speak. Where is the infarct? A. Basilar artery. B. Middle cerebral artery. C. Posterior cerebral artery. D. Anterior spinal artery. Answer. Basilar artery. Explanation. Locked-in syndrome results from bilateral ventral pons infarction due to basilar artery occlusion, sparing the reticular formation. Consciousness. Vignette 5. Wernicke's aphasia. A 58-year-old woman has fluent but nonsensical speech and difficulty understanding others. Where is the lesion? A. Broca's area. B. Wernicke's area, temporal lobe. C. Occipital lobe. D. Angular gyrus. Answer. B. Wernicke's area, temporal lobe. Explanation. Wernicke's aphasia is caused by damage to the superior temporal gyrus, MCA infarct, leading to fluent but impaired comprehension. Vignette 6. Broca's aphasia. A 61-year-old man has difficulty speaking but understands speech perfectly. He can only produce broken, effortful speech. Where is the lesion? A. Wernicke's area. B. Broca's area. C. Arcuate fasciculus. D. Angular gyrus. Answer B. Broca's area. Explanation. Broca's area, inferior frontal gyrus, MCA infarct, leads to non-fluent speech with intact comprehension. Vignette 7. Conduction aphasia. A 65-year-old woman has difficulty repeating sentences but speaks fluently and understands speech. Where is the lesion? A. Broca's area. B. Wernicke's area. C. Arcuate fasciculus. D. Angular gyrus. Arcuate fasciculus. Explanation. The arcuate fasciculus connects Broca's and Wernicke's areas. Lesion, conduction aphasia, poor repetition but fluent speech and intact comprehension. Vignette 8. Cerebellar lesion. A 47-year-old man has intention tremor, dysmetria, and dysthyrokinesia. Where is the lesion? A. Basal ganglia. B. Cerebellum. C. Motor cortex. D. Thalamus. And cerebellum. Explanation. Cerebellar lesions cause ataxia, intention tremor, and dysmetria. Lateral lesions, limb ataxia. Medial lesions, truncal ataxia, vermis. Vignette 9. Hemiballismus. A 60-year-old man has sudden, wild-flinging movements of his right arm. What brain structure is affected? A. Basal ganglia, subthalamic nucleus. B. Cerebellum. C. Internal capsule. D. Red nucleus. Answer. Basal ganglia, subthalamic nucleus. Explanation. Hemiballismus is caused by a lesion in the subthalamic nucleus, often due to a lacunar stroke, contralateral side affected. Vignette 10. Decorticate versus decerebrate posturing. A brain-injured patient presents with flexed arms, extended legs, and clenched fists when stimulated. Where is the lesion? A. Above the red nucleus. B. Below the red nucleus. C. Basal ganglia. D. Cerebellum. Answer A, above the red nucleus. Explanation: decorticate posturing, flexion, lesion above red nucleus, cortex, internal capsule. Decerebrate posturing, extension, lesion below red nucleus, midbrain, brainstem. Final thoughts. These